On this episode of the Paw Report, we're talking about endocrinology. Well, what's that, you ask? It's the study of hormones and how they control our pets' different body systems. Unfortunately, sometimes hormone balance goes wrong, and when that happens, disease results. With more on that, we're joined by Dr. Gregory Mauck from the Kaskaskia Valley Animal Hospital next. Production of the Paw Report is brought to you by
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Okaw Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. Okaw Vet Clinic located at 140 West Sale Street in downtown Tuscola. More information available at okawvetclinic.com.
Well, thank you for joining us for this episode of the Paw Report. Kind of a complicated topic we're talking about today, but that's why we invited Dr. Gregory Mauck with us today to kind of sort things out. And we're talking about the endocrine system. That's a big word and really hard to spell, but you've been seeing some issues with that come through your office. So thank you for joining us for this episode, and we're going to talk about that. So why don't we start there? The endocrine system does play an important role, not just in human bodies, but in our pets' bodies too.
Right, and we see a lot of endocrine disease. So the study of endocrine disease is endocrinology. So you hear that a lot, and a lot of people have their own endocrinologist they see all the time. So it's a very common disease. We see, there's hardly a day goes by I don't deal with it. The most common things we see with that are thyroid disease, adrenal gland disease, and diabetes. But there's lots of other endocrine tissues in your body. And then sometimes things like tumors will develop an endocrine component to them. Like, for example, there's a common tumor we see in dogs where they develop a tumor near the anus. It's called a perianal gland tumor. Well, it will start producing hormones that mimic parathyroid gland hormones, so which messes up your calcium levels. So there's lots of endocrine diseases and tissues, but the main ones we deal with are thyroid, the adrenal glands, and diabetes. And so what endocrinology, or what the endocrine means, glands produce substances. If the substances go outside of your body, like sweat glands or your pancreatic enzymes, which are being dumped into your intestines, those are exocrine glands. If they're being dumped back into your bloodstream directly, like insulin or thyroid hormones, cortisol, those things, things from the pituitary, those are endocrine because they're going back into your body. So that's what endocrinology is dealing with those tissues.
Now, you touched on a few, but there are lots of different diseases that could be spawned in our pets if that system is out of whack.
Right. And so, like, just take the thyroid, for example. Dogs almost always have low thyroids. I've never seen a dog with a hyperthyroid, a high thyroid. Cats basically always have high thyroids. I've had one cat in 28 years of practice who had a low thyroid. So they could have it, we keep it in the back of our minds, but that's just probably not gonna happen. So, but what happens in hyperthyroidism in cats is that they develop a little, usually a tumor tissue. It's usually not malignant, but it can be, but that's rare. It's usually benign, but there's a little tiny tumor in the thyroid glands that's producing excess thyroid hormone. So your thyroid hormone tells your body how fast to rev. So it's how much gas is on the pedal.
Good way to explain it.
Yeah. So if you've got too much, you've got too much pressure on the pedal, and your body is going 80 miles an hour all the time, which is very damaging. It can cause heart failure. It can. These cats come in and they used to weigh 11, and now they weigh 6 pounds. So that's hyperthyroidism. Hypothyroidism, which we see in dogs, is usually a situation where the thyroid gland basically dies. The cells just die off, usually from a immune effect, and so they can't produce thyroid hormone. So in that situation, we don't have enough gas in the tank, and these dogs gain weight. Their skin looks terrible. You need thyroid hormone to turn your skin over and things. So they look really bad. Their hair falls out. They don't produce. They rub their hair off of like their elbows or their tail, places like that, and it doesn't grow back.
I was just going to ask, what are some of the signs? And I know, when you're talking about thyroid disease, diabetes, hypothyroidism, they're all going to have different signs, probably. But,
Yes.
I have an animal, it's just not acting right. What are some of the other things that I may look for, signs to know that something's just not right?
Right. Well, a couple things. One thing, you just look at your animal and look, what doesn't look right. Like, for example, there are times I walk into a room, and I had this happen recently, had a large retriever, and walked in the room, looked at it, and then just immediately, that dog's got thyroid disease. He had a tragic expression. Whenever you have low thyroid, you produce these molecules called mucopolysaccharides. They're great big sugar, mucousy molecules, and they get under your skin. And so then your skin gets heavy and it drifts down, and you look like, you're horribly depressed. And we call
You
this.
could see that in this retriever?
So they just, they look horrible. People do that too. You have to be pretty hypothyroid to do that, but it does occur. And so that's a very common thing. The skin on this dog was flaky and dry. The hair coat was very sparse. So the hair coat, the skin will hyperpigment and will get darker.
How long did that go on?
That's probably been going on months. The thing with a lot of these diseases is that they're very gradual. And so the owners may not notice them as they occur because it's just very gradual along, and they don't, it's just kind of like the old thing where you put the frog in the boiling water, supposedly, and as it gets slowly warmer, you don't notice it. But somebody else might show up and hasn't seen the dog for 2 or 3 months. Oh my gosh, what's wrong with your dog? But the owners haven't noticed that. And so that's a common thing. So we look at the dog, and does anything not look right? Like Cushing's disease, where you have an overactive adrenal system, they develop a pot-bellied appearance a lot of times. And the skin gets very thin. And so we'll have these little poodles come in, they've got a big pot belly, and you can see the blood vessels through the skin on their abdomen because the skin's so thin. So that's just some comments. You might look at your dog and, he really doesn't look normal. His skin just doesn't look good. It's not, shiny and nice, and it's, he's got these worn off spots, or by golly, he does have a big pot belly. And that happens because the thyroid hormone, cortisol, weakens the muscle. And so their abdominal muscles thin and weaken, and they're just pressure from their abdominal organs bulges out, and they can develop this pot-bellied appearance.
What about eating? They're lethargic,
and
no energy.
Yeah, a lot of times eating, actually, most of the time with a lot of these diseases, increases. Diabetes, typically you eat more, you drink more, you pee more. Those are kind of 3 biggies. Cushing's disease, same thing, the appetites increase from the cortisol. They also urinate more with that because the cortisol dilutes their urine. So they can look, we have an animal comes, hey, my dog's eating a lot and he's peeing a lot. That's the first 2 things we think about is diabetes, but also hypercortisol, Cushing's disease. Addison's disease, a low adrenal system, you don't have enough cortisol, a lot of times those dogs' weights are dropping off rapidly and they're not eating because they feel so terrible. Hyperthyroidism, a lot of times with cats, they're eating like crazy and yet they're losing weight. So again, that can be confused with diabetes because it's the same deal. eating huge amounts, losing weight.
You know, there is a laundry list, it seems like, of all the different diseases if your endocrine system is out of whack.
Yeah.
Is one more prevalent than the other? I had a pet that was diabetic. I had to give her insulin shots
Yes,
twice a day.
yeah.
Is diabetes probably one of the more popular ones? Or?
Yes. Yeah, we deal with lots of diabetic dogs and cats, pets in general, super common. Hyperthyroidism in cats is very common. Low thyroid in dogs is very common. The adrenal ones are not as common, both the high and the low. But they're, we still see quite a few, but way less than the other two.
You know, as you alluded to earlier in our conversation, I'm a pet owner, and you know, you see your dog or cat every day, and you may not notice something, you know, slowly, but over time, you start to develop signs that something might be wrong. How long can you really wait before something like this is treated, before something bad could happen?
Well, it can happen fairly quickly, and usually when things get critical, it becomes very obvious. Like, for example, we had a cat come in a couple weeks ago with diabetes, and it was literally filling its litter box up. I mean, the amount of urine was just phenomenal. My mom and dad's cat years ago, when it developed diabetes, it was just looked like somebody had poured water into the litter box. There was so much urine. Dogs will start like needing to go out to the bathroom outside 5 to 10 times a day instead of a couple or 3. Just those type of symptoms. So it becomes real obvious. But one, and the weight loss can become so, in cats, I mean, they can just literally plummet in their weight. So things can be sneaky at first, but when things come to a head, it usually becomes pretty obvious something's going on.
You mentioned that sometimes when the endocrine system is out of whack, it can be hard to diagnose. It can be hard to, see. Talk about that as a vet, and what you go through and what you struggle to kind of diagnose somebody's pet.
Yeah, because a lot of, some of these are very obvious, where I do walk in and, wow, that dog looks like it's got thyroid, or that dog looks like it's got Cushing's. A lot of times it's not like that. It may be more where the people come in, my dog's been urinating more, but he looks totally normal and things. So, or we just will find stuff, like we'll do general blood work or something just piques our interest. Hey, it looks like maybe something's going on, because we're in the early stages. So we have to do blood work to diagnose all of these. But most of them, the tests are not 100%. So we have to be very careful what we do with the numbers we get. So now, if we have a dog who we suspect with diabetes, and we get a blood glucose and it's 600, well, there's just really nothing else that's going to cause that. We can be pretty sure right then this dog's got diabetes. So that's a fairly easy one. If there's sugar coming out in the urine and they've got a 600 blood glucose, that's pretty much case closed. Thyroid disease is a little more difficult. So we have a dog, well, they look like they might be hypothyroid. Or maybe we're just doing a senior panel, just a screen of blood work to see if there's anything going on. Those tests can be a little more difficult, because let's say you're on the low side of normal. Like I had a dog the other day who the dog I was just talking about that looked obviously hypothyroid. Well, when we did his test, normal on the test for the thyroid hormones 1 to 4, well, he came back 1.3. So if you took it just, right down the line, you'd say, well, he's in the normal range. 1 to 4 is normal, he's 1.3, he's normal, he doesn't have thyroid disease. Well, that's not correct. One thing, your thyroid hormone is not constant in your body. So if you measure it all day long, it goes up and down all day long. Little bits, not a huge amount, but we might have caught that dog on his high end, and then during the day, the rest of the day, maybe he's down at 0.7. So his average is below normal. So you have to take the numbers in association with the clinical signs. And Cushing's disease is super important with that. more maybe along the lines of 80% accurate. So we have to look at this dog. Does this dog have symptoms of Cushing's? Does his blood work that we're testing support that or not? And look at both of those and make a clinical judgment. And one thing especially with Cushing's, the treatment for it it's kind of dangerous, to be frank. We have to be very careful with it. So we're not just going to throw around treating Cushing's just because the numbers are abnormal. I had a dog this week whose test for Cushing's, we were looking at other issues, but his Cushing's number came back elevated, the cortisol and the cortisol test. But this dog has no symptoms of Cushing's disease clinically. So even though his numbers were high, we're not going to treat that dog for Cushing's. He has no symptoms of it, and that's what we're really treating. It's a touchy treatment, and you can actually cause more problems with it than you're helping if you're not careful with it. So, but the tests you have to take them with a grain of salt. You have to look at the numbers we get and then look at the dog clinically and then decide, where we're at with this.
Kind of a two-part question. One, this sounds to me like it's not just you're going to know what the diagnosis is the first time I come into your office. It sounds like the diagnosis could take some time, number one.
Yes, I can definitely do that.
Two is treatment. I'm sure every single ailment that your pet is diagnosed with, it's going to be a different treatment regime. So I'll let you answer both of those questions. We'll start with the diagnosis. It's not some instantaneous thing you're going to know.
No, not for the most part. There are blood chemistry things machines that can test for thyroid, for example, in the office. So that's available. It's a total thyroid, but it doesn't tell us the whole thing. Most of the time, we're going to draw blood for thyroid, send it off to a lab, and get numbers for different things we look at. And that's going to take a few days. But most of these diseases, other than diabetes, and Addison's disease can be a critical situation. But most of them aren't things we have to deal with today. Now, Addison's disease can be critical now. It's something that, if we're in an Addisonian crisis, you can die, like now. So that's something we have to, and so that's one of those things where sometimes we have to not have tests. There's certain tests we can do in the office, like look at a potassium level. With Addison's, they can shoot through the roof and cause heart block, and they can die. And so we can look at a potassium, but we can't do a cortisol level today, cortisol test, and get the results today. That's just not going to happen. Mm-hmm. So some of those things we have to. Diabetes is the one thing we can. Yes, your blood glucose is 600, your ketones are through the roof. We need to institute therapy right now, but most of them aren't. Cushing's, is not something we're going to diagnose today. We might get an idea today, but we're not going to have an absolute, know what we're doing. And so with a lot of these diseases, other than if we're in an emergency situation, we don't want to go off until treating them until we're absolutely sure we've got this disease we're going to deal with. So that's important. But all of them, obviously have different treatments. If you're low thyroid, you're going to take a thyroid supplement. If you're high thyroid, we're going to give you drugs that prevent your abnormal gland from continuing to produce high levels of hormones. If you got Cushing's, the next thing, Cushing's is a syndrome. It's not a specific disease. So there's different things that can cause Cushing's. In Cushing's disease, you're producing too much cortisol from your adrenal glands. Well, you may have, and there's always a tumor involved for naturally occurring Cushing's. It's usually not malignant, but can be. But for the most part, you're either going to have a tumor in your adrenal gland that's just going to produce cortisol by itself, or you're going to have a tumor in your pituitary gland that's producing too much of the hormone that tells the adrenal glands to make the cortisol. So you have a tumor in one of those spots. And so we deal with those two things in two different ways.
Remove the tumor?
Yeah, we can't get rid of the tumor. If you have a pituitary tumor in a dog, Rarely a cat. That's not something we're going to be getting rid of. If you're a person, you're probably going to be either having surgery, radiation, that type of thing to destroy that tumor. But that's not really available for dogs and cats. So if you have a pituitary tumor, it's going to continue to produce ACTH, which is the hormone that tells the adrenal glands to make the cortisol. So we can't stop that. But so then we go to the adrenal gland and give them a drug that damages their adrenal gland so that it doesn't continue to make the cortisol. The ACTH is still going to be pouring in there from this pituitary tumor, but the adrenal glands are going to be damaged so that they can't respond to it. That's the touchy part of the treatment, because if we damage them too much, then you can't make any cortisol, and then this dog that was Cushing's now becomes Addisonian, develops Addison's disease, which is actually more dangerous than having Cushing's. So if you are a naturally occurring Addison's dog, that's an immune disorder where your immune system destroys your adrenal glands. And so then you can't make cortisol. So we have to replace that by giving oral prednisone and injections of other types of hormones that control your sodium-potassium levels in your body.
So just a lot of different treatment options
Yes,
depending on.
yeah, lots of stuff.
What about breeds? And what about dogs versus cats?
Yeah, dogs versus cats first. I mentioned a while ago about cats with thyroid. They're always high, dogs are always low, basically. Diabetes is basically equal, I would say, in cats and dogs. We get lots of both. One thing with diabetes, it can be slightly different. Cats, they say, kind of have a little bit more of the type 2 like people do. We think of diabetes, it used to be type 1, type 2. Type 1 was insulin dependent, juvenile diabetes. Type 2 is adult onset, possibly not insulin dependent. But really, we really need to think about diabetes as insulin dependent and non-insulin dependent. And dogs and cats, for the most part, are always insulin dependent. So, but pretty much equal in those breeds. The adrenal gland stuff, big difference. Cats very, very rarely get Addison's disease, which is the low problem. Dogs, it's not a common disease, but they're the ones that get it. High adrenal, where you're producing too much cortisol, is again quite rare in cats. It does occasionally occur. I've seen a couple cases, but it's mainly a dog problem. So the adrenal stuff, mostly dogs, rarely cats. Thyroids, cats are high, dogs are low, and diabetes is about the same.
Breeds? Different breeds it's
yes.
prone to?
So like dogs, for example, a lot of schnauzers get diabetes. I won't say lots of schnauzers get it. I shouldn't say that. But they're much more prone to getting it than other breeds. When they get it, a lot of times it's worse. They tend to get ketosis associated with their diabetes, which is a problem with fat metabolism. You produce toxic metabolites from fat, and it makes things a lot worse. So schnauzers with diabetes tend to be a bigger problem than another dog. But we tend to see diabetics tend to be smaller breed of dogs. We definitely get large breed. We've had 150-pound dogs getting huge amounts of insulin. But I would say 75% of the dogs we deal with diabetes are small dog breeds. Cats, it doesn't, the most of the cats we see are domestic short hairs and things anyway, or domestic cats. I don't know that there's any huge difference in many of the other cat breeds. Are just really not that common that I could make a judgment. But most of the cats we deal with are just plain old cats, with
plain
those
old
things.
cats.
Yes. And then talking about the adrenal stuff, that's definitely is a difference too in dogs. Like again, schnauzers are very prone to getting Cushing's disease compared to other dog breeds. Just one of the things they do. But a lot of these are just very mixed. In the adrenal Cushing disease, where you get the adrenal tumor versus the pituitary tumor, tends to be small breed dogs tend to get pituitary tumors. Large breed dogs, it's maybe half and half. So if we see an adrenal tumor, it tends to be a big dog, but I've seen adrenal tumors in little dogs too. And I've certainly seen lots of big dogs with pituitary tumors, but the adrenal tumor definitely is more common in large breed dogs. And then as far as thyroid problems in dogs, certain breeds like golden retrievers are kind of notorious for thyroid disease. Doberman pinschers, tend to get it. But we see it in lots of dogs. That's definitely more of a big dog problem than it is little dogs. We get some little dogs with thyroid problems, certainly, but they tend to be bigger dogs.
The key is, if you see something a little quirky with your dog or cat, just make sure you get it checked out.
Yeah, because these are sneaky diseases.
Yeah, always interesting to talk to you, Dr. Mauck.
Yes.
Thank you for joining us on the Paw Report today. Look forward to seeing you again sometime with another interesting topic. And we thank you for joining us for this episode of the Paw Report. We'll see you next time. Production of the Paw Report is brought to you by
Okaw Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. Okaw Vet Clinic located at 140 West Sales Street in downtown Tuscola. More information available at okawvetclinic.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.